Hello, my dear subscriber and viewers. Welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about medical coding guidelines for arthroscopy of knee and shoulder joint. In last video, I have explained about coding guidelines for fracture treatment and spine procedures. So part 1 fracture treatment, part 2 spinal procedures. Those who are not watched that video, please watch that video. So that both video is very major procedure, and this both video will be useful to clear your CPC exams. So I have pasted both videos links in the description box. So before going into the video, those who are not subscribed my channel, please subscribe my channel. So if you feel this videos will be useful to your friends, please share to your friends, and if you like this video, please give like button, then only my video will reach to many people. So whenever you are going to press the subscription button, so please press the bell button also and select the all, then only you will get my future videos as a notification. Okay, let's start coding guidelines for arthroscopy. So the first point is, so whenever surgical arthroscopy include diagnostic arthroscopy. So diagnostic arthroscopy and surgical arthroscopy, we should not bill together. So whenever surgical arthroscopy is performing for same patient, same knee, then we should not code both together. Okay, if the arthroscopy is performed as procedure to access the surgical field or to extend the disease, then it is not separately reportable arthroscopy with the main procedure. Then if diagnostic arthroscopy leads to decision to perform an open procedure, then diagnostic arthroscopy may be reported with the main procedure with 58 modifier. Okay, so then medical but we need proper medical necessity for the diagnostic arthroscopy. Okay, so this point I am telling continuously in each chapter, so because this is a basic guidelines. So whenever arthroscopy is converted to the open method, only open method we have to code. So as I told you before video, so scopy is converted to the open method. So one method is doctor is started, but it fails to another method. So which method doctor is completing to that procedure, so we have to build that method as a final CPT code. So if the arthroscopy procedure is performed to the open procedure, so only open procedure may be reported separately. Okay, so next point is, we can bill arthroscopy, diagnostic arthroscopy and open method also when if the procedure performed on control lateral shoulder or control lateral knees, then we can bill it both codes separately with appropriate modifier. If it is same site, we should not bill. If it is different laterality, then arthroscopy and main procedures we can bill it together. Okay. Next point, if the arthroscopy is performed as procedure to access the surgical site, so whenever main procedure doing to access that site, doctor may do the arthroscopy, and end of the procedure also doctor may do the diagnostic arthroscopy to check the any complication of the procedure, like that. So those the reasons we should not code arthroscopy separately with the main procedure. Okay, if the findings of diagnostic arthroscopy leads to decision to perform an open procedure, then diagnostic arthroscopy may be reported separately with 58 modifier. Okay, so same day the patient is coming for any pain and diagnostic arthroscopy performed, so doctor identified the main diagnosis. So same day itself doctor deciding to perform further main open procedure, then we can bill both codes together with 58 modifier. So whenever you are billing for the arthroscopy, you should check medical necessity for diagnostic arthroscopy. Okay. So next point is shoulder and knee arthroscopy debridement shall not be reported with the surgical arthroscopy procedure when performed on the same joint at the same patient encounter. Okay, understand? So whenever debridement and main procedure doctor is performing on the same joint, we should not bill debridement to the main procedure. But when we can build the knee debridement code, so let's see, 298.744 for removal of loose body or foreign body code, then 298.77 for debridement or shaving of the articular cartilage. So both code we should not report to the other knee arthroscopy codes, which is 298.66 to 298.89. So with this range of code, that both debridement and removal of loose body we should not bill together, but with two exception we can bill it. When so HIPICS code is G0289 CPT code. This code describes for removal of loose body, foreign body, debridement or shaving of articular cartilage at the time of the other surgical knee arthroscopy, if it is performed in different compartment of the same knee. Okay, note it correctly. If that removal of loose body is performed in different compartment, then we can bill it both code together. Okay, so because 298.80 and 298.81 both code description itself saying debridement code is included, either it is same or different compartment. So debridement always included to that main procedure, but I am not talking about the debridement. So code describes debridement also G0289 and removal of loose body also G0289. So here the important point what I am saying, so the removal of loose body performed in different compartment other than the main procedure, then the G series HIPICS code we can bill it with the other arthroscopy knee procedure code. Okay, so please check from the medical report whether removal of loose body performed from same compartment or other compartment. If it is if only performed in the same different compartment, then we can bill it. So we should not bill G code to the main procedure if it is same compartment as another knee procedure. Okay, next, so same point, shoulder debridement code limited code is 298.22. This code is for limited debridement, and 298.23 is for extensive debridement of shoulder. So both code also we should not bill to the main procedure, but extensive debridement is performed in different area of the same shoulder, then we can bill 298.23 to the main procedure. So we need proper medical necessity to bill that procedure. So doctor has to mention extensively debrided, but that procedure performed in different area of the same shoulder, then only we can bill both code together. Okay, so 298.24 distal claviculectomy including distal articular surface, 298.27 arthroscopy shoulder surgical with a rotated cuff repair, 298.28 for shoulder surgical biceps tendinitis. So these are the main procedures from the shoulder. So to these three procedure to CPT codes only, the 298.23 we can bill it if it is different area of the same shoulder. Okay, so next point is synovectomy always included to the main procedure, because maybe a doctor may do that synovectomy to clean up the joint before doing the extensive procedure. To clean up the joint, doctor may perform synovectomy procedure. So for that reason, we cannot code synovectomy to the main procedure. But some exceptions, we can build synovectomy with the main procedures. Okay, so the synovectomy code is 29875 is for limited synovectomy, and 29876 is for major synovectomy. Major means this synovectomy has to performed 2 or 3 compartment, then only that we can consider as a major synovectomy. So 29875 code description itself saying separate procedure. So we already saw in the basic surgery coding guidelines, so separate procedure, the word if doctor is mentioned, the CPT code is describes a separate procedure. So those procedures we cannot build to the other main procedures if it is the same joint or same site. If it is different site, then we can code both together. But here the limited code for synovectomy is a separate procedure. So anyway, we cannot build to the main procedure if it is the same joint of this shoulder. So okay, 29876 is for major. So that synovectomy, as I told you already, to clean up the joint on which another more extensive procedure is performed, then it is not separately reportable. But 29875 shall not be reported with another arthroscopic procedure on ipsilateral of knee. Okay, so if it is 29876 may be reported for medically reasonable or necessary synovectomy with another arthroscopy knee procedure on ipsilateral knee if the synovectomy is performed in 2 compartment on which other major synovectomy with the 298 with the other arthroscopy procedure not performed. So check which compartment doctor is doing main procedure, to which compartment doctor is doing another synovectomy procedure. If same compartment itself is doctor is doing both procedures, don't bill it. If it is different compartment main procedure and other compartment synovectomy, then we can bill it together. So if we need proper medical necessity to build the both CPT codes, extensive major synovectomy code and extensive procedure. Okay guys, that's all about arthroscopy coding guidelines. So if you have any doubt, please comment in the comment box. So those who are going to write CPC course, please follow my channel. I am going to post throughout all chapters, even ICDs and CPTs. Then if you want to check read theoretically, so each chapter, please check my blog site also. So I have pasted my blog links in the description box for this chapter. And even if you go to my blog, you can see all chapters in theoretically. So all points I have taken from this EMS website, so don't worry. And then if you like this video, please like and share to your friends also. And thank you for watching my video. Thank you so much. Bye bye. So let's see in the next video other all major like minor procedures from the musculoskeletal. Okay, thank you guys. Thank you for watching my video. Bye bye.